Hello, Namaskaram, dear respected members, learners, students, as well as aspirants. Today, I want to share a little bit regarding to gout, Gout. Normally, gout is old age problem, but it can happen anytime. Whenever we are saying the gout, it's mean this particular disorder is related to the joints. And in this case, what happens? In case of acute gout, it will start from weak toe. Normally, it will start from the weak toe, or we can say metatarsalopharyngeal portion. So, pain, severe pain, inflammation, swelling, these are the common symptoms of the gout. Sometimes, in this case, maybe severe pain, and it is because of development of, we can say, gouty arthritis. What happens in this case? There is processing of metabolic processing of purine metabolism. So sometimes there will be the excess activities of xanthine oxidase, the more formation of uric acid may take place inside our body. And if the uric acid will not be properly soluble and will not be excreted from our body, then it will form a type of crystal that is referred as monosodium urate crystals. Needle like crystals will be there. And these crystals mainly will deposit into the synovial fluid of the joints, and they are needle like. When so many needle like crystals are clustered to each other, they can form a group of cluster that is referred as toffee, and this is very painful for our joints. So the main cause of this one, we can say, precipitation, excess precipitation of uric acid in the form of urate crystals. As we know, the normal level of uric acid is near about 3.5 to 7.2 milligram per day. But whenever it will be more, then it will precipitate out in the form of crystals. Due to these crystals, there will be the inflammation in joints, a redness will be there, swelling will be there, as well as pain. So sometimes what happens, the WBCs will try to phagocytize to these crystals. Due to this one, inflammatory reactions happens. So many types of cytokines, release of so many types of cytokines and inflammatory contents will lead severe pain as well as swelling, or we can say inflammation. So what are the main causes of gout behind of it? We want to see. One is hyperuricemia, mean higher level of uric acid, and it's happening due to the purine metabolism. Mean we can say the conversion of purine into uric acid will be more here. So it is one of the most important cause. Another, someone is taking the purine rich diet, then no doubt the processing will be more and formation of uric acid will be more. The person who are taking the alcohol, it is not favorable for the gouty arthritis or gout, because indirectly it helps for the precipitation of the uric acid, because uric acid will be easily precipitated in the presence of alcohol, and its excretion through the urine will be also less. Those persons who are taking the diuretics, we can say as a hypertensive drug, in that cases it is also, this one is favorable for the gout processes, or for the formation of gout, as well as obesity excess fat deposition is also not favorable for the, you can say, this disorder. So ultimately, uh, ultimately there will be the development of swelling, tenderness, pain, etc., and etc., into joints. Primarily it will happen into the big toe. Now, how we will relieve from this one? What are the management behind of this one? So first of all, the person who are suffering from this one, we have to take the NSAID, non-steroidal drugs, in which we can take such as the brufen, naproxen. Along with this one, we can take the corticosteroid as well as the colchicine also. So due to this one, there will be the relief of pain, swelling, etc., and etc. If the hyperuricemia is there, for this purpose there will be the need of investigation of uric acid in blood. So if it is more than 7, then without any hesitation, it's higher uric acid is there, precipitation is there. But for the proper authentication of this diagnosis, uh, we can see the urate crystal, monosodium urate crystal, also by photographic method. So it is a confirmatory test to know the this one, monosodium urate crystals. This can take from aspirational way of synovial fluid of joint. So these two parameters we can say one, investigation of uric acid, as well as observation of sodium crystals, urate crystal. By that one we can authenticate gout is there. Regarding to treatment, first treatment is that anyhow we have to control or regulate the pain as well as inflammation with the help of non-steroid drugs, such as the brufen, we can say, aspirin, we can say, as well as naproxen, etc., and etc., along with the colchicine and corticosteroids. If the concentration of uric acid is more, then no doubt the one drug is very famous as a anti-gouty or anti-uric, that is called allopurinol. So allopurinol we can start for the purposes of that one. By starting allopurinol, it will control the lesser formation of the uric acid. Along with this one, we have to see is about of lifestyle things also. In this one, purine rich diet we should have to not take, mainly red meat or general meat, seafoods, etc., because in these cases there will be the high purine rich. So we should have to avoid this one. Diet management should be there. The content of protein should be selected, as well as alcohol consumption should be nil, and hydration should be there. Hydration time to time we have to take the water, so that the precipitation of crystals should be less. And along with this one, obesity we have to control, otherwise it will lead more complications. So management of obesity, if a person is obese, we have to control. And proper selection of diet. With the help of these things, we can control the gout. So it was little bit regarding to this one. Very, very thanks to all of you. Thank you. Namaskar.